As a parent, the health and well-being of your newborn baby is your top priority. Thankfully, most babies are born healthy and strong. However, some infants, especially those born prematurely, can face serious medical challenges. One such challenge is hyaline membrane disease, also known as respiratory distress syndrome. This condition affects the delicate lungs of newborns, making it difficult for them to breathe properly. HMD is a significant concern in neonatal intensive care units around the world. Although it can be frightening for parents to learn their baby has HMD, understanding the condition, its causes, symptoms, and treatments can empower parents and caregivers. In this essay, we will delve into the details of HMD, providing you with the knowledge and reassurance you need during this challenging time. Remember, medical advancements have significantly improved the outcomes for babies with HMD. With proper care and treatment, most infants go on to live healthy lives. This essay will serve as a guide to understanding HMD and will provide insights into the latest medical advancements in its treatment and prevention. Hyaline membrane disease, or HMD, is a breathing disorder that primarily affects premature infants. It occurs when a baby's lungs are not fully developed and lack a crucial substance called surfactant. Surfactant is a slippery substance that coats the tiny air sacs in the lungs called alveoli. This substance helps keep the air sacs open, allowing the lungs to inflate and deflate properly. Without enough surfactant, the alveoli collapse, making it difficult for the baby to breathe. This leads to a lack of oxygen in the bloodstream, which can affect other vital organs. The term hyaline membrane refers to the thick fibrous layer that forms in the air sacs of babies with HMD. This membrane further hinders the baby's ability to breathe. The severity of HMD varies depending on how prematurely the baby is born and the degree of surfactant deficiency. Babies born at or near their due date rarely develop HMD, as their lungs have had sufficient time to mature and produce surfactant. However, babies born prematurely, especially before 30 weeks of gestation, are at a much higher risk. The primary cause of hyaline membrane disease is a deficiency of surfactant in the lungs. Surfactant production in a baby's lungs typically begins around 26 weeks of gestation, and increases significantly in the final weeks leading up to birth. Therefore, babies born prematurely often have insufficient surfactant, making them highly susceptible to developing HMD. While prematurity is the most significant risk factor for HMD, other factors can also increase a baby's likelihood of developing the condition. These include maternal diabetes. Mothers with diabetes, especially if poorly controlled, are more likely to have babies with HMD. High blood sugar levels in the mother can interfere with the baby's surfactant production. Cesarean delivery. Babies delivered via cesarean section, particularly elective C-sections before labor begins, have a slightly higher risk of HMD compared to vaginal births. This is because the stress of labor helps to stimulate surfactant production in the baby's lungs. Multiple births, twins, triplets, or other multiple births are more likely to be born prematurely, which increases their risk of HMD. Family history of HMD. If a family has a history of HMD, subsequent babies may be at an increased risk. Understanding these risk factors is crucial for healthcare providers to identify babies who might be at risk of HMD and take appropriate preventive measures. Section 4. Recognizing the symptoms of RDS. Recognizing the symptoms of hyaline membrane disease early on is crucial. Symptoms appear within hours after birth and vary in severity. Common symptoms include rapid breathing, grunting, and nasal flaring. Cyanosis and chest retractions indicate severe cases. Seek immediate medical attention if you notice these symptoms. Section 5. Diagnosis and treatment of RDS. Diagnosing hyaline membrane disease typically involves a combination of physical examination, medical history, and diagnostic tests. Doctors will assess the baby's breathing pattern, listen to their chest with a stethoscope, and observe for any signs of respiratory distress, such as those mentioned earlier. A chest X-ray is often used to confirm the diagnosis. The X-ray will show a characteristic ground glass appearance in the lungs, indicating the presence of collapsed air sacs and hyaline membranes. Blood tests may be conducted to measure the baby's blood oxygen levels, carbon dioxide levels, and blood pH, which can indicate the severity of the respiratory distress. Treatment for HMD aims to support the baby's breathing and improve oxygen levels in the blood until their lungs mature and begin producing sufficient surfactant. Oxygen therapy is a primary treatment method where supplemental oxygen is delivered through a nasal cannula, mask, or, in severe cases, a mechanical ventilator. Mechanical ventilation involves using a machine to assist the baby's breathing. The ventilator delivers breaths of air enriched with oxygen into the baby's lungs through a tube inserted into the windpipe. Another crucial treatment is surfactant replacement therapy. This involves administering artificial surfactant directly into the baby's lungs through a breathing tube. Section 6. Prognosis and prevention of RDS. The prognosis for babies with hyaline membrane disease has improved significantly due to advancements in neonatal care. Most infants respond well to treatment and live healthy lives. However, severe cases may lead to complications like chronic lung disease. Preventing HMD involves proper prenatal care and managing maternal health. Corticosteroids before delivery can reduce the severity of HMD. Early detection and prompt treatment are crucial for the best outcomes.